when you talk about the conservative treatment of either a cartilage defect or arthritis, once you've made the decision, okay, we don't think we need surgery, well, what are your options for treating it? And you can start with, there's supplements, there's activity modification, weight loss, there's braces, there's prescription strength anti-inflammatory medicine, and those are all kind of first tier things. Maybe just modifying your workout program or doing an early morning workout, because that you'll feel better all day if you do that as compared to working out late. But if you get to the point where tier one kind of basic inexpensive things aren't working for you, then absolutely injections can be of benefit. They just play different roles. And I think the ones that you'll hear about that are common, cortisone is kind of a wastebasket term for corticosteroid injections. These are different chemicals, brand names that reduce inflammation. It's a steroid type of mechanism to reduce inflammation. It has a very strong anti-inflammatory effect, but it's usually fairly short-lived. And so those can be helpful for arthritis. You have to be a little bit careful. You hear about these injections being done many, many, many times over the years, potentially causing damage in the knee. Some of that's related to the local anesthetic medicines. You don't want to have a lot of that put in the knee. You can have some. It's not a big deal to have a little bit with it. But it may be the local anesthetics that cause the damage to the knee over a long haul rather than the steroid. So I generally use steroids if a knee has a lot of acute inflammation and swelling and you're trying to get it to calm down pretty quickly, something like gout or a real flare-up of arthritic pain. Then you have the other categories of injections that are kind of maintenance injections, and they're PRP is one. That's platelet-rich plasma. That's your own blood. They draw it, spin it down, and the plasma has a rich concentration of platelets in it. This has different proteins and hormones in it that are kind of growth type factors that turn on your body and have a little bit of a regenerative effect. I wouldn't really extrapolate that and say it's regenerating cartilage, but it does create a healthy environment. It reduces inflammation, and there's some healing proteins and molecules that are your own bodies that you're concentrating and putting in your knee. So it's been well shown that reduces inflammation. And so we use those pretty liberally. There's variability regarding insurance coverage. Most insurance companies don't cover that, so it's an out-of-pocket expense. But it's a reasonable expense with some pretty good data that backs, the use of it. There's good data that shows it does reduce inflammation, and you get somewhat of a lasting effect, maybe 6 to 9 months with that. And then HA products, hyaluronic acid, HA is a chemical building block in cartilage. It also is absorbed into the synovium, which is the lining of the knee joint, and it reduces inflammation. So it's a little bit of a nutritional molecule for the cartilage that you do have left in your knee. Water content is good, and it helps the cartilage kind of be beefy and robust, and so that can help you. It can also reduce inflammation by acting on the synovial lining and the cells there and just kind of letting your knee calm down. So often that's used alone. Often PRP is used alone, and then a lot of times we use it in combination where you just do both. A lot of people kind of come in every couple of years, kind of get a maintenance dose of that. I think that it is beneficial, but the benefit may not be dramatic. It's of mild benefit to your knee. If you have really, really bad pain, it may not be the thing for you. You can try it. It's of no harm, totally safe. But basically, the worse the arthritis and the worse the pain, the less that's probably going to help you. The more mild your inflammation and the more of your own cartilage you still have left in your knee, the more it's going to help you.